this afternoon. Scott Benton is the Conservative MP for Blackpool South. And we ought to say, actually, we booked Scott Benton before the news emerged in the past 2 or 3 hours that the NHS Trust in Blackpool was declaring an internal critical emergency. Such are their staffing problems right now. Scott Benton, thanks ever so much for joining us. Can you tell us what the situation is at the Trust? This is NHS staff going off sick or self-isolating and therefore simply leaving the hospital with a major shortage of staff.
Good evening. A critical incident has been declared in Blackpool. So yesterday we saw a similar thing happen in a number of hospitals in Lincolnshire as well. What declaring a critical incident means is this allows the chief executive of the hospital more room for manoeuvre in terms of dealing with those staff shortages, looking at which elective surgeries can go ahead to make sure cancer patients and other urgent treatment can continue, and to also mitigate the pressure on A&E. So my message for my constituents in Blackpool would be this: if you do have a problem and you need to go into A&E, then please, of course, go and present yourself. But please be mindful of the pressure on the hospital and the rising number of COVID cases, and take sensible precautions to protect people working in that healthcare setting.
That's advanced that could mitigate the pressure on NHS staff is for them to self-isolate, not for the 7 days they currently have to, but for 5. Listening to Chris Whitty in that briefing there, he didn't seem particularly enamoured of that idea, and it's not as if the Prime Minister stepped in to say, no, actually this is something under active consideration. It sounds like the 7-day self-isolation period in England will stay.
That's my understanding as well. I think moving to 5 days would clearly be beneficial. I certainly think my chief executive in Blackpool would support that as well. And what I do understand from our local situation is the staff shortages are now in the realm of 10 to 15%. Now, if you think of any public or private sector industry, it would be very difficult for most organisations to function with that high staff rate. And the government have reduced the self-isolation period for society as a whole within the last week. But I do think in critical industries, including the NHS and education, also some food producers and suppliers as well, we really do have to revisit this situation, because society can't come to a halt. And obviously, it's critical NHS workers can present themselves for work if they are fit to do so.
Scott, I don't know whether you're actually able to listen to what the Prime Minister had to say in that briefing. I'd be curious to know as to what you felt the main headline was there. My ears pricked up when he said he will be recommending to Cabinet tomorrow that there are no further restrictions. He says we're sticking with Plan B.
That was my understanding as well, and I welcome that. Obviously, before Christmas, I was one of the members of Parliament who voted against the so-called Plan B measures. At that time, I felt it was too soon to bring in the COVID passport and the additional requirements around wearing masks. So I'm sure these measures from number 10, the fact that we won't potentially be having more restrictions, will be welcomed with open arms, not just among Conservative MPs, but among the country as a whole. The pressure on the NHS is significant, but I think it would be an overreaction at present to reach once again for more restrictions when, upon the data I've just seen in that press conference, I don't think those would be required at the present time.
Were you struck, as I imagine many of our viewers were, by the hospitalisation data? And you can see the horns of the dilemma this government's on, can't you? Because the mortality figures, though very low and not like previous waves, all the early evidence from South Africa seems to be holding true. This is more transmissible but less lethal. But the difficulty the government faces is that though it's a small rise, it's still a rise, and until it peaks, you can't be sure.
That's definitely the case, and what we've seen, again, not just in Blackpool but in Lincolnshire, is hospitals declaring critical incidents, not just because of the additional number of COVID patients, but because some of the wider structural issues in the health and social care economy. So the number of staff absences, the fact that there aren't necessarily staff available in care homes and local authority controlled institutions and care settings to allow people to be discharged from hospital into those settings. So it's not just a case of looking at the hospitalisation figures and the infection figures. There's a whole realm of different factors out there in terms of healthcare settings which we have to consider. And this is a problem at the moment. Nobody knows when the number of cases is going to peak, or indeed the hospitalisations, and what the pressure in 2 or 3 weeks could be. The government, in my opinion, made the correct decision to allow Christmas and New Year to proceed relatively intact, unlike, of course, Scotland, Wales and Northern Ireland. But inevitably, what we're going to see in 2 or 3 weeks from now, again, potential further spike in cases because of what happened along the holiday period. And I think that will really be concerning number 10 at present as well.
Scott Benton, MP. Appreciate your Scott, thanks very much indeed for your time. Thanks a lot. That's some political reaction to what the Prime Minister had to say this afternoon. Let's get some clinical reaction. Dr. Omika.